We've been following how the coronavirus strikes people of color at a higher rate, with health equity being something followed closely now. Well, one group that's showing danger signs is Black youth. Joining us now to talk about this is Maisha Smith, child and adolescent clinical social worker at Hartford Hospital Institute of Living. Thanks for joining us.
Thank you for having me.
So as the pandemic progresses and police violence surges, we're seeing increased suicide rates in Black youth. What have you seen in relation to these taxing issues during this unusual time?
So we are seeing definite increases in depression due to the isolation that is happening right now. Youth are feeling isolated from their friends, from family members, and also their community. But it is also important to mention that this is not a new issue of Black suicide in terms of the youth. This is something that has been long-standing, and it is actually due to the number of health inequities and structural racism that actually exists in the medical field that prevents people of color from actually seeking help.
What would you suggest when important media covering both issues, the pandemic and police violence, starts taking a toll on someone's mental health?
It is very important that we stay mindful of the amount of exposure to violence that our youth is receiving, especially when we're looking into the media. It's important that we're having conversations with our youth about what they are seeing, both in their communities and also on social media and also on the news.
So what resources do people have who might want to seek support?
Here at the IOL, we have a number of resources. We have outpatient treatment. We also have partial hospitalization services if that is necessary. There are also a number of community agencies as well that people can feel free to reach out to. It's important that youth are feeling connected to the individuals that are helping them get through these tough issues.
And Maisha, what would be your message you'd like to send to young people of color who might be struggling with their mental health right now?
It's important for our youth to know that they are not alone, that what they are feeling is not atypical, that many people experience depression and anxiety, and there is absolutely nothing wrong with seeking help.
All right, you are not alone. We love it. That's a great message. Maisha Smith, thank you so much for joining us today. We appreciate your time.
Thank you.